Testing. Hello, everyone. Hope you can hear me. Dr. Conrad here. Thank you so much for joining me this Sunday. This has been a very exciting month for me. I attended two major homeopathic meetings. We had our National American Institute of Homeopathy meeting in Chicago, which was just wonderful. Meeting with a lot of the top homeopaths of the world, discussing homeopathy, new ways of taking cases, new techniques, new remedies. Been really exciting, and I hope maybe a little later to share some of this information with you. And then yesterday, I attended the Florida State Homeopathic Society meeting. Dr. Roger Morrison and Dr. Nancy Herrick were speakers. And it was exciting for me because they spent some time at the Florida Wellness Center. We spent a day together talking about old times because both of them were my teachers about 15 years ago when I studied homeopathy. And I would really encourage all of you, one of the best ways to continue your homeopathic education and knowledge is to join a study group. And it's easy to find a study group if you go to the National Center. Excuse me here. If you go to the National Center of Homeopathy, their website, and you can Google National Center of Homeopathy. 1 minute here. There. You can go to the National Center. I think we're having a problem. Let me just check something here. Testing. 1, 2, 3. You can go to the National Center of Homeopathy website and just look at all the existing study groups. These study groups are a great way of meeting other people who are studying homeopathy. And then I also would encourage you to attend, a homeopathic meeting to learn more. Okay, well, let's begin today's class. 1 moment here. And I have the questions here. I hope if you do have anybody has any trouble hearing, I'm hoping that the audio is going to be much better today. I've checked out all the equipment, and this is being recorded for those of you to listen to later. Okay, what we're going to do is we're going to be talking about reactions following a remedy. This class, we're going to talk about miasms, breast conditions, dysmenorrhea, immunizations, and we'll go over the review of cases and some materia medica. Now, reactions following a remedy are probably more important if you're doing constitutional prescribing. So typically, when you are treating an acute case, something that comes on rapidly, cold or flu or injury, aggravations are really unusual or unlikely, but they can occur. And it's important that you do understand, what an aggravation is, be able to diagnose it, be able to understand it, and be able to take the necessary steps. There's also something called a disruption. A disruption is a little bit different than an aggravation, and we'll clarify that. There's also a suppression, and that is pushing the disease state deeper into the body. And there's also something called an initial euphoria. And this is something that everybody loves after taking a homeopathic remedy, getting this initial euphoria, feeling good. And because of this initial euphoria, many people
want to take the remedy again, and they want to repeat the dose. It's like you get used to this new level of energy, a higher vital force. And when you get used to it, it's still there, but it's not as prominent. And many times people will unnecessarily take and repeat taking the homeopathic remedy when it can cause more harm than good. So let's first talk about an aggravation. An aggravation is a temporary worsening of a pre-existing symptom, followed by an amelioration, or the fact that means it's just getting better. Now, then improvement of the person or organism as the whole. So the key here is a temporary worsening of a pre-existing symptom. And usually it's just very short-lived, um, and it can be alarming, and it's always disheartening if the aggravation is the primary symptom that the person is coming to you for. So if it's a migraine headache and you give a homeopathic remedy and the migraine headache gets a lot worse, and that's the aggravation, that can be alarming. We like to avoid aggravations if possible, and I'll talk a little bit more about how we can reduce the aggravation. Um, and um, but the fortunate thing with an aggravation is that an aggravation is actually a good sign sometimes because it means you got the right remedy. And it is also a short lived condition. It doesn't usually last very long. As I mentioned, this usually doesn't occur in first aid or acute treatment. So, most of you who are doing acute prescribing, first aid treatment, you shouldn't have to be concerned about an aggravation. If it occurs in an acute disease, it most likely represents the natural progression of the disease rather than an aggravation. So, by natural progression, let's say you're getting the early signs of a flu, and you take a homeopathic remedy and you get a fever or the temperature goes up a little bit more, the cough gets worse. It may not be the actual aggravation of the homeopathic remedy, but it's actually the natural progression of the disease. So I hope that's clear. Um, Aggravations occur uh, uh, because there is a weak vital force. That means that the person is somewhat debilitated or weak, and the homeopathic remedy is stronger than the disease process of the homeopathic remedy. The energy of the homeopathic remedy is too powerful to kind of overwhelms the disharmony. That's why we always like when we prescribe homeopathy to be gentle. We always like a remedy to kind of match the disease state, not to be overwhelming. And that's one of the ways that we determine how high of a potency. If the symptoms um, are pretty clear and the person is strong, then we can always go with a higher potency. But if the symptoms are not clear and the person's weak, then we want to go with a lower potency. One of the biggest mistakes that many homeopaths make is to use too high of a potency. I believe we're always better off starting lower and then gradually increasing the potency. So, using a 30C and then later on, if you get a favorable reaction and doesn't last, then go up to a 200C. But many times, what I'll do is I'll just keep on repeating the uh, 30C. Okay, is the sound a little bit better, or are we still going in and out? Okay, is anybody else having a problem? Debbie is commenting um, every few minutes my voice is gone, then it comes back. Is anybody else having that problem? Just type, because what I can do I'll try to change my internet connection. Okay. I'm hoping it's a little bit better because initially I was hearing some static. So if anyone else is having a problem with the sound, anybody else having problems with the sound, let me know. Or is Debbie the only one? Okay. Okay. Let me let me get a different internet connection. I'm going to get a different internet connection, and hopefully this will take care of it. All right. 1 second. What I what I'm doing here is I'm going to my Wi-Fi card. Hopefully this will be a better connection. While we're waiting for the Wi-Fi, any questions? Okay, I'm going to be switching to a different internet. If I lose people, just come join me back in. Okay, just join back into the webinar. Okay, I'm going to be switching now. Testing, testing, 1, 2, 3. Debbie, you hear
Yes,
me
sir. I can
okay?
hear you now.
Okay, it's
I
much
can hear
better.
you now.
All right, good.
I can hear you.
Norm, did you have a question? Hello? Okay, I think we have a much better audio connection. Okay. Um, Also, aggravations are not just unique to homeopathy. They're also common in other forms of holistic medicine. For example, um, fasting. You know, when you begin a fast, initially you feel crappy until the toxins leave your body, then you feel a lot better. So generally, it's better just to, let an aggravation take its course. Uh, a lot of times, if you do, blood studies or laboratory tests, they generally are negative for symptoms. So if you do get a fever after taking a homeopathic remedy and you do blood tests for white blood cell counts or changes in the blood, they're typically negative because these aggravations are usually related to symptoms and not clear cut physical pathologies. So, in order to understand aggravation, Hahnemann states that when you give a similar remedy, it stimulates the organism by moving it into a deeper aggravation. So, remember, one of the ways that homeopathy works is this law of similars. So, we're giving a similar remedy, similar to the actual physical disease or the physical symptoms. So, it stimulates this whole process and it kind of magnifies it. Remember homeopathy, we want to push the organism, the person, to a better state of health. We want to push it gently. So, one way of looking at it, the homeopathic remedy, we want the energy of the disease or the malvibration or the disharmony, we want that energy to kind of take over the person's disharmony so the body no longer has to do it. Is it necessary always to have an aggravation? Generally speaking, an aggravation is a good sign. Anytime I give a homeopathic remedy and I'm treating a constitutional case and I get a rash or I get some type of aggravation, I'm kind of happy because I know the remedy is causing some type of an effect. A lot of times aggravation they go unnoticed. By that I mean the person isn't sensitive enough to experience it. And of course, we have different constitutions. Some of us are extremely sensitive and we notice everything. Other people are kind of stoic and, they suppress these subtle things in their body. Now, the key is we always, when we have an aggravation, we want to know, is it a new symptom? By definition, an aggravation is something that is a pre-existing condition or something that they had before in the past. If it is a new symptom related to the remedy, then this might be a proving symptom or something that is coming from homeopathic remedy. Aggravations can occur within seconds up to a week. In fact, I even heard of cases where aggravations occurred months later. We like colds or discharges, and these can happen 3 to 4 weeks into a treatment. Anytime we get a cold, a nasal discharge, a diarrhea, or something like that, remember the body is healing. The body is healing from inside outward. So that is a good sign when we do get some type of a cold or a discharge. Earlier, we talked about remedies have a certain pace. A remedy like belladonna is a very, very fast-acting remedy. Aconite's a fast-acting remedy. And then we have slower remedies. And typically here, this list, calcium salts, potassium salts, silica, they act very slow. And they affect protein production in the body and subtle biochemical changes. So whenever you're using any of these remedies, an aggravation may occur later, and even the positive effects of the remedy may occur later. In some situations, you need to have the patient wait in the office to make sure they're not having an aggravation. For example, if I'm treating somebody with a high intraocular pressure in their eye and I give a homeopathic remedy, I would want to wait and maybe recheck the pressure to make sure they're not getting an aggravation. They're not having an increase in their intraocular pressure. So those of you that are treating, primarily acute conditions, wait, take the remedy, and wait. A friend of mine developed a retinal detachment over the weekend, and he's scheduled for surgery next week. So I took his case and used the rubric retinal detachment, and it was also there was an inferior loss of his vision. And so if you go to loss of vision, altitudinal, or lower field, there's a small rubric with a few remedies. But the two remedies that came up were aurum metallicum and digitalis. So I asked him, he is a homeopathic doctor, so I asked him to take the aurum metallicum. And then I did a follow-up on him to see if it was any better. There was no change, so I asked him to repeat the aurum. So in this case, you need to try to be on top of things, even though he has surgery scheduled next week. If you are going to be evaluating a homeopathic remedy, you want to do some spot checking. And in particular, in his case, I would not want the homeopathic remedy to cause an aggravation and actually worsen a detachment. So you want to make sure that you're using the right potency. Let's see, Norm, did you have a question, Norm? Because your hand is up on the board here. Let's see. Hey, Norm, do you hear me?
Yes, I do.
Yeah, your hand is up. I don't know if you're raising your hand for a question. Are you? Okay. All right. So no question. Okay. False question. So once again, if you do have a question at any time, um, please, either raise your hand in the question area or type a question. Let's see. All right. Most commonly, if there's an aggravation of the chief complaint, it is a good therapeutic response. It's usually followed by an amelioration or general improvement. So, whatever the chief complaint is, you get that initial aggravation. When I was treated for my asthma, I had an initial aggravation. I thought my lungs were getting real tight. Thought I was going to get an asthmatic attack, and then it just passed away. And then I had a general improvement. Of course, once again, especially if you get an aggravation with an asthmatic attack, that can be, a dangerous situation. So you have to be careful and monitor. Maybe start out with a low potency, gradually increase. Sometimes the chief complaint will change. Like, for example, the migraines, each headache will be less painful and shorter duration. So if something is occurring in a periodic fashion, let's say migraines once a week or migraines every month, of course, when you take the homeopathic remedy, you're not going to know initially the effect until 1 week later, 1 month later, when uh, typically the symptoms will occur. This is also true for seasonal disorders. If you had allergic symptoms, let's say in the fall, and you give the homeopathic remedy in the summer, you're really not going to know the effect until the fall season comes, typically when the symptoms are a lot worse. This is also true with menstrual problems and periods and things like that, hormonal cycles. Sometimes, the first cycle or the first period when the symptoms do occur may be somewhat worse. So you have to wait a couple of cycles until you determine whether or not the treatment is going to be effective. And this is important because sometimes if you wait the first cycle, generally speaking, if you're not sure, continue the wait. And I think that's a good policy to have in any homeopathic treatment. If you're not sure, you're better off to wait. And this is the case with menses. It's important to wait. After the first period, the remedy may not change, but the second or third, there will be. Sometimes the aggravation is prolonged, sometimes even several weeks. And this is especially true too high of a dose, especially in skin conditions. It may take months to clear. So we always have to be very careful if we're treating a chronic skin problem like psoriasis or eczema. In those cases, I usually like to give a very, very low potency under a 30C, maybe a 6C or a 12C, and then wait. You never, never want to give a high potency like a 200C or a 1M or higher with a skin problem, a chronic skin problem. Because remember, the body heals from inside outward. It could be an excellent remedy, but if you give a high potency and you get a severe reaction, especially with the skin, you're not going to have a happy patient. You're not going to have a happy patient. So you're better off going very, very low. This is probably one of the trickiest things is return of old symptoms, because many times um, people don't remember their old symptoms, especially if it was long ago in the past. Um, so you may have fallen and injured your knee, and then you take a homeopathic remedy, and you develop some aches in your leg, and you think it's arthritis or a severe aggravation. It's a return of old symptoms. So typically, when I'm reviewing a response to a person after they take a homeopathic remedy, we talk about all the symptoms that they have had. And of course, if they're an existing symptom, um, then we evaluate the severity of the existing symptom, or if there's any change in the characteristic or nature. But anything that they tell me is that's new, I'll carefully inquire to see if this is a new symptom or if it's a return of old symptom. Remember, a return of old symptom is something good in homeopathy. Why is it good? Well, earlier in the class, when we talked about Hering's law, that many of us have had symptoms or conditions that weren't treated properly, they were suppressed. And as we are treated homeopathically, as we're treated in a homeopathic manner, our body begins to heal and these old symptoms will return. Um, Aggravations are more than physical symptoms, they can be emotional and mental. So in behavioral disorders, a child may be worse for a few days. Or in treating depression, you may become depressed for a few days and then become better. Typically, we don't like to see mental and emotional aggravations because there's a hierarchy with symptoms. The mental and emotional states um, tend to be a higher order of disease, more severe than the physical. So, generally speaking, I'd rather see a physical aggravation and a mental and emotional amelioration or an improvement compared to the other way around. If you have a um, um, marked improvement of a physical symptom and a marked mental and emotional aggravation, that's something we don't like. Something we don't like, and you really have to look at the remedy and see if you have the right remedy. An aggravation of severe pathology, sometimes you can't afford to have this type of aggravation. Coronary artery disease, Crohn's disease, and of course, for me, it's any eye disease. So, you never want to treat a person with glaucoma, macular degeneration, or some severe eye problem and have them get an aggravation with their vision because that can destroy the patient doctor relationship. That can affect their future interest in homeopathy. And that's one of the reasons why I like to use a low potency in treating eye problems. And in particular, that's one of the reasons why I like the LM potencies. The LM potencies are uh, something that is more gentle to the body, and typically aggravations do not occur early when you're taking an LM. They usually occur towards the end of taking the homeopathic remedy. So LMs are kind of opposite of the centesimal or C potencies or M potencies. Those remedies, you get the aggravation early and then an amelioration and an improvement. With the LMs, they're very gentle. You don't see an aggravation until maybe after they're taking the remedy for a couple of weeks or a couple of months. In at least that situation, you have gained the confidence of the patient, and when they do get an aggravation, there's a better understanding. There's also something called a pseudo aggravation. That's someone um, when they stop taking their allopathic medication, at the same time they begin taking their homeopathic medicines. So that can sometimes be confusing because they're getting an aggravation, but it really has nothing to do with the homeopathic remedy. I'm faced with this all the time when I'm treating people with glaucoma. I always emphasize to them, don't stop taking your glaucoma drops. Because if they stop taking their glaucoma eye drops and at the same time begin the homeopathic remedy and their pressure goes up, is it due to the fact they stopped their eye drops? Or is there an aggravation uh, from the homeopathic remedy? Another example would be treating sinusitis with antibiotics that uh, clear up the acne. Uh, and then the acne gets worse because they stopped the antibiotics, not because they started the homeopathic remedy. Okay. Let's see here. Now, sometimes there's a non-therapeutic aggravation. Um, a remedy will cause an aggravation followed by amelioration, however, no general improvement of the patient's health. So when that occurs, you have a remedy that's close, but it isn't the correct remedy. So let's say you're treating someone with chronic sinus problems. They do get an aggravation. They get some slight amelioration, but the sinus problem is still there. Well, you got to relook at some of the symptoms and see if you can come up with a better remedy. Or the second option is to repeat that particular remedy and see if you have a better effect. Now, often in homeopathy, we're assuming that the remedies that we give to our clients or patients are of good quality. So, just like in any industry, sometimes you may not have a good preparation of a homeopathic remedy, or it could be a preparation that has been antidoted either because of high temperature. So, in some cases, when I really feel strongly that it's the right remedy and it doesn't have an effect, I may give the remedy again from a different manufacturer and see what happens. So that's something to kind of keep in the back of your mind, that if you do feel it's a well chosen remedy and it doesn't work, um, let's see here. Okay, there's a question here. Is there one or two remedies you like for chronic skin problems? Well, there isn't one or two remedies that is good for any skin problems. Um, you really got to take the case. You really got to take the case because there's probably maybe 100, 200 different remedies that can treat skin problems. So, um, you got to go through the case taking technique. Where are the skin lesions, the nature of the skin lesions, the color of the lesions, are there discharges, and also the symptoms of the person. Are they itchy? Do they scratch them till they bleed? There's all these rubric for skin problems. And as you know, taking this course, that you also have to look into the mental and emotional nature of the person. Are they anxious? Are they depressed? So all these things will lead you to a good homeopathic remedy for the skin. Generally speaking, in homeopathy, sometimes skin problems are toughest to treat because remember, the body heals from inside outward. And sometimes you have a chronic skin problem that is just persisting there because the body is healing itself. You know, It is having this, aggravation. So I think for a beginning homeopathic practitioner, you should be very, very careful in treating skin problems. Now, it's different if you have an acute problem, something that comes on very quickly, like, let's say, a herpes lesion that comes on very quickly, maybe a boil, an abscess, maybe a patch of eczema that comes on quickly, an acute skin problem, poison ivy, getting bit by a bug or a bee, and you have a skin problem. These are things that respond very well and they're easier to treat. But chronic, long-standing skin problems, uh, most homeopathic practitioners really respect them, and they're tough to treat. Even if you want to venture there, I would recommend you go with a very, very low potency, very, very low potency. Now, one of the nicest things about homeopathy is this initial euphoria. And this is always great to experience and great to see in our clients or patients. Um, they haven't felt better than they have in years, improvement of energy, and it gradually wears off. And I don't think it really wears off. They just get used to living at this level of new freedom and they want more. It's kind of an addiction. So never make the mistake of repeating a homeopathic remedy just because you want to get that euphoria back. So the goal of treatment is not euphoria, it's to treat a particular physical problem. Now, most homeopaths, I shouldn't say most, but many, including myself, can give a placebo. A placebo is a homeopathic pellet. It looks like a homeopathic remedy, but it's not impregnated with anything. And I have a funny story to tell you. I had a lady that did really well with homeopathy. I knew it was the right remedy, but she wanted more, and she felt that the homeopathic remedy was losing its effect. So I gave her a placebo. And when I gave her the placebo, she thanked me because she felt so much better. It brought her energy back. So she was taking the placebo once a week. She ran out of the placebo, and I didn't have the same size pellet. It was a different size pellet. So when I gave her the different size pellet as a placebo, she took that and she called me up and was complaining. She said, it's the wrong homeopathic remedy. It didn't have the same effect. And I thought that was really funny. So I had to give her back the same size pellet, which was a little larger, and the placebo effect occurred. And this is a very common way of treating patients in India. In India, the homeopathic doctors want to see their patients or clients every week. And every week they give them a placebo. They come into the office, they talk to them, and they give them a placebo. They get the main homeopathic remedy, but they're observing the action, but they do get a placebo every week. So the role of placebo can be very helpful in homeopathy. There can be a related phenomena, increased in appetite, fatigue, change in sex drive or menses, change in dreams. So an aggravation can occur in many, many different ways. So it's important then to um, listen to the patient, review all these subtle changes that take place. And typically what I do when I do a follow-up, I go through all the changes in their symptoms, new observations that I have, and I make a list and I simply go through each one and I try to determine in which direction is the healing going. Is it an aggravation? Is it a new symptom? And sometimes it can be very complex, but generally speaking, it's always better to wait. So if you're not sure, just wait. Um, that's the best policy. Um, should you warn the patient of aggravation? And I think it is essential to warn the patient because otherwise, if they do have a severe aggravation, then it appears like you're kind of covering your tracks. So I tell every patient that I'm treating constitutionally that they may get an aggravation of their existing symptoms. They may get a skin rash. They may get a discharge. Although I don't think this is as important to do whenever you're treating an acute, because, like I said, it's less common to get an aggravation when you're treating an acute. This is more of an issue when you're venturing into the world of constitutional prescribing, which is a deeper level of prescribing. So listen to the aggravation, listen to the echo, the resonance that's echoing into the body, and try to find out what's going on. Because after you give a homeopathic remedy, this is an opportunity to determine if it's a good homeopathic remedy, if you need to make some changes, what type of effect are you having in that particular person. So now let's talk about disruptions. Okay. When new symptoms arise, while the old ones go away, but the overall health of the individual remains unchanged. So this is kind of a horizontal change in the symptoms after a remedy. So in other words, the person really isn't getting better. It's just moving from one part of the body to another. Like, say, for example, someone has a migraine headache. The migraine headache gets better, but now they have a chronic sinus problem. So you have to determine whether this is a disruption. The energy state is being disrupted, or if it's a suppression, or if it's an aggravation. But typically, when this disruption occurs, when you have a new symptom that the person never had before, and that's the key. It's a new symptom that they never had before, not a return of old symptom. It's usually a disruption, especially if the overall health of the individual remains unchanged. And that's key, overall health. So if you have a new symptom and the energy level is much higher, the temperament and emotional state is much better, then that's probably not a disruption. But if the mental and emotional state is the same, the level of fatigue is the same, and it's just simply a new symptom, but maybe an old one went away, that's a disruption. So that means that the remedy is not similar enough. And by similar enough is it's not exact. And sometimes this can be an opportunity, because then what you do is you take the new symptom and you put that new symptom into your repertory, into your formula, to try to come up with a much better or more similar remedy. So you take your remedy list of symptoms and you take this new symptom and then you plug it into your analysis, maybe putting a little bit more emphasis on the new symptom. Suppression is something that we do not like to see in homeopathy. And I think it's always been my main goal to avoid suppression. So in suppression, the presenting symptom improves, but the patient as a whole is worse. This is the same thing that the allopathic doctors do. Example, the gastritis clears up, but the energy level is less, or they develop depression. So in other words, the particular presenting symptom improves, but mentally and emotionally, energy level is a lot less. So If you're treating someone with glaucoma and you prescribe them a homeopathic remedy and their pressure is lower and their vision's better, but they have less energy, they have depression, or they have some anger issues, it's suppression. It's suppression. The right remedy will clear the energy level or the depression. But the gastritis might come back for a short while. So remember this. When you do have suppression and you have this kind of reverse Hering's law that the symptom improves, but there's a change in the mental, emotional, or energy level. If you do give the right remedy, the reverse may happen, this being a law of cure. So this is something really important to understand, and it's something that as you study homeopathy, you're going to become more and more aware of movement of the disease. What is suppression? What is aggravation? And this is so important for understanding whether or not you have a good homeopathic remedy or not. Okay. Any questions on suppression? Let me see here. I'm just checking the list. Okay, let's continue. There's something also called a proving. If you take a remedy frequently enough, and engrafting can occur. So that means that the energy of the remedy has somehow gotten into the patient and has become part of that person's energy. It's called engrafting. This is something rare in homeopathy, and it's very difficult and complex to treat when it does happen. So this is one of the important reasons why you should not take a homeopathic remedy repetitively or frequently. And that's one of the biggest dangers in homeopathy. If you take a homeopathic remedy, repeat it too frequently, you could develop a proving, and it could become engrafted or kind of embedded it in your physical makeup. And essentially, you'll begin to prove all the symptoms of that remedy. It's rare, but it can occur. Just to emphasize that you should avoid taking a homeopathic remedy repeatedly. That's why the general rule in homeopathy is you take a remedy once, wait, and see the reaction. There's something called coincidental reactions. This is when you give a constitutional remedy and later they develop the flu or another symptom, and possibly this had nothing to do with the remedy. It's coincidental. So sometimes this can be difficult to sort of sort out, and it takes a little detective work. And when in doubt, just wait and see what happens to the person's energy or the symptoms. There's also something called expectation. Any medicine, allopathic or homeopathic, has a placebo effect. There's a certain desire by the patient or your client. They want to get better. They come to you for a consultation. You put a certain amount of energy into trying to find a remedy that's going to help them, and it will have a placebo effect. But usually the placebo effects are temporary. They're not as long lasting as the correct homeopathic remedy. And there are some patients who will want to read about the homeopathic remedy and feel these positive or negative feelings, which influenced our expectation. I know this has happened to me over and over again. Um, they find out the name of the remedy and they read about the remedy and they say, "Well, this is not me. I'm not this remedy," and because of that, that can have a negative effect. I know that when I took my homeopathic remedy that had a dramatic effect on my asthma, I said, no way am I that remedy. You know, it, I think it's just impossible for you to really understand your remedy because, you're looking at yourself through kind of rose colored glasses. So most people, when they find out their true constitutional remedy, there's a certain amount of denial. Am I, really that remedy? Or they look at the list and say, well, I don't have this, I don't have that. But remember, um, no matter what constitutional remedy you have, there's going to be parts of that remedy that have not been um, manifested in you. So it's not like you read through the remedy and everything about that remedy is you, because we tend to, resonate or vibrate in subtle different ways. And of course, each homeopathic remedy has a spectrum of disease and health. So just because you're a phosphorus doesn't mean you have a certain amount of delusions and excess sympathy and things like that, because every remedy has an extremely healthy state, and then they have an extremely unhealthy state. So there's a whole spectrum with our homeopathic remedies. And now I want to talk about miasms. Miasms are another really important aspect of homeopathic prescribing. Um, and in order to be a good homeopathic prescriber, you need to recognize the miasms that are present in the person that you're treating. It's less of an issue, the miasms, in treating an acute problem than it is in a constitutional case. I would say when you're treating a constitutional case, the miasms are extremely, extremely important. And most of homeopaths will tell you, the experienced homeopaths, is probably understanding the miasm is the most important step in then determining the homeopathic remedy. So, in a way, it kind of makes it simple because we have three primary miasms. So, we need to just kind of pigeonhole the patient into one of those miasms depending on their symptoms, their nature, their temperament, and the miasmatic characteristics. There are some other people that have classified up to 9 miasms. And over the weekend, I listened to a lecture by Dr. Roger Morrison and Nancy Herrick. They talked about kingdoms in homeopathy, but they also have written a book and lectured on the miasms in homeopathy, and they have a 9 miasm classification based on the work of Rajan Sankaran. But for this particular class, we're going to focus on the primary miasms to kind of make it simple. So, miasm comes from the Greek word meaning defilement. And this is the idea of something wrong or wrong with the person on a deep level. This idea of poisoning, that we have an inherently weak nature, which makes us um, uh, makes us susceptible to disease. The homeopathic dictionary defines miasm as an infection or noxious vapor or atmosphere. Um, the pathogenic influence of a particular disease process upon an organism responsible for a wide or distinctive range of morbidity, not necessarily characteristic of the pathology of the original disease. So an example for this is all of our hereditary tendencies. At one time, syphilis was very prominent, and the syphilis disease was transmitted to the offspring, not so much as an active infection, but in terms of congenital defects. There were changes in the teeth, changes in the eye, characteristic manifestations, congenital defects of the person. And you would see this with tuberculosis too, even though it wasn't really the active disease. It was just kind of like the energy and of the disease that changed the genetic structure, um, which became like a familial trait. And so we see this now, that there are certain traits within a society, family, or individual making them susceptible. So, for example, in your family history, if you have a tendency towards obesity, you may have a tendency towards diabetes or heart disease. These tendencies are related to what we describe in homeopathy as a miasm. For example, there's a cancer miasm. So if there's a strong family history of cancers, that's the cancer miasm that's becoming manifest. If you have a tendency towards lung disease, uh, that's the tubercular miasm, and so forth. So we'll be talking more about these particular miasms and how they can be helpful in evaluating a homeopathic case. Um, One of the qualities is that it's infectious. Many of our miasms, there is a sexual transmission. Two of the miasms, the psychotic miasm is related to gonorrhea, and the syphilitic miasm is related to syphilis. And the other one is the psora miasm, which is related to a skin infection. The key characteristic is that it is passed deeply into the vitality of the organism. So it's more than just an infection that passes and leaves the body. It somehow resonates in the DNA, in our genetic structure, and it is passed from one generation to the next. So this is, familial tendencies. And at the American Institute of Homeopathy meeting, there was a really interesting um, presentation on survivors of the Holocaust. That there was a couple of homeopathic doctors there who have been treating survivors of the Holocaust, not only those people, but their children and their grandchildren. And what they observed, typically, survivors of the Holocaust have really suppressed their particular experience, and they do not talk about it to their children. And the interesting thing that surfaces with these children, they have a lot of nightmares um, of being pursued. They have a lot of mental and emotional disturbance where they don't know where it's coming from. And I thought that was so fascinating. Um, so there are like a lot of frightful fear type of homeopathic remedies like aconite, stramonium that are helpful in this group. Now, the grandchildren or the children of these people, they tend to be more interested. It's like the grandparents begin to open up to the grandchildren, talking about their experience of the Holocaust. And then there tends to be less in the way of nightmares and dreams and phobias and mental and emotional abnormalities because they're speaking more about it. So this is a kind of like energy that is transmitted in the genetic material. So when we are doing constitutional work, it is important to find out, family history of health and disease and all these issues that can help you better understand the person at that particular point in time. Um, Factors that point to a miasm. Well, anything that begins at birth. So if you're born with a congenital problem, a congenital heart defect, a cleft palate, you're born with hearing loss, that points to a miasm. Usually, if it's some type of a destructive process at birth, that points to the syphilitic miasm. A strong family history of a particular condition, heart disease, diabetes is a miasm. Individual characteristics, we mentioned birth defects. Pace and directionality. Miasms are directional in nature. They describe the pace and flow of energy in the case, and we'll talk about that later when we discuss each one of the individual miasms. Sometimes you can go back in the family tree and actually determine the history of the initial disease. Like, for example, a grandparent who had syphilis, who maybe had to be institutionalized, and that hereditary pattern is then transmitted through each generation. Now, and I'm convinced of this, that homeopathy can change the genetic transmission. Homeopathy can change the genetic manifestation. So I never like to hear a patient say, well, I'm doomed. Everybody in my family has diabetes. I'm going to get it. I strongly feel that the right homeopathic remedy can change the genetic manifestation, and the right homeopathic remedy can then change the genetic transmission. So, homeopathy can be a wonderful modality to stop the adverse inheritance in families and in family members. As I mentioned, miasms are more important in constitutional case taking. They're less important in dealing with acute taking. So the syphilitic miasm is one of destruction, introverted and turning inward. The disease is turned inward to a really destructive manner. So these are people that are suicidal. They can be homicidal also, very, very destructive. And all of the physical pathology that takes place is destructive. So you get corneal ulcerations, um, optic atrophy with the eye, ulcers on the leg, uh, deformities of the hand, advanced cardiovascular disease, aortic aneurysms. So these are manifestations that you see in a person that are very, very destructive, that are damaging the body, not only physically, but also mentally and emotionally. That's the syphilitic miasm. So that's kind of like the extreme of the whole miasmatic representation is syphilitic. The next miasm is a psychotic miasm. And this miasm is characteristic of excess, and it flows outward. So this is discharges, warty growths, tumors, uh, so an excessive production of tissue. Hypertension could be considered psychotic. Also, glaucoma, elevated pressure of the eye. Um, but then, the psychotic miasm can then turn into the syphilitic. So if you just have mild high blood pressure, but as soon as the high blood pressure causes like an aortic aneurysm or a stroke or some type of destruction, cerebral aneurysm, a heart attack, then that becomes more syphilitic. So I hope that's clear. These miasms tend to go in a certain direction. And of course, you can change. You can go from one miasm to another depending on your evolution. Now, the psoric miasm stands more in the middle, and this has to do with weakness, fatigue, allergies. The psoric miasm, in a way, describes the first mechanism of how a body reacts to disease, how a body reacts to some type of irritation. So, when you're initially exposed to a disease or an infection or some type of noxious stimuli, your body begins to react by itching, burning. It's just an irritant. And then maybe it then leads to weakness, fatigue, or allergy. So it's the way the body reacts. Then you can take that same initial problem that is causing the body to react. But then if it develops an excessive growth, a discharge, warty tumors, or some type of a tumor, then that's a psychotic miasm. And then, of course, the psychotic miasm then could lead to a destructive lesion. So there's kind of a continuum in the way the body responds to disease. So you can have kind of like the continuum in one person, but generally speaking, our physical nature is such that we tend to react to disease in one of these three methods, either the psoric method, psychotic, or syphilitic. So each one of our homeopathic remedies is related to a specific miasm. Some of the remedies are bimiasmatic or trimiasmatic, meaning that each homeopathic remedy can manifest in more than different ways. At the meeting in Chicago, I listened to a brilliant homeopath, and he felt that all of our remedies can manifest in a different miasmatic form. And that when we are taking a homeopathic case, it is important that we find out the most syphilitic symptom that is going on in the organism, and that typically has the most value. So, in other words, when you're taking a homeopathic case, some symptoms are going to be psoric, some symptoms are going to be psychotic, and maybe you may have one or two syphilitic symptoms. That's the one that you want to pay more attention to, according to Dr. Vijayakar, who's a brilliant Indian homeopath who is trying to incorporate this miasmatic analysis in the homeopathic case taking. So here are some classic remedies and miasm. The acute miasm is aconite and belladonna. These are two remedies that we're familiar with, and also stramonium. I don't think we covered that much with stramonium. The psoric miasm, calcarea carbonica, sulfur, lycopodium, serinum. I know we covered the calcarea carbonica, sulfur, and lycopodium. The psychotic, which is the miasm that's related to the gonorrhea. Natrium sulfuricum, meterinum, and thuya. And it's interesting, all of those three remedies, one of the characteristics is warts and warty growths. So typically, when you are doing a constitutional case, if there's a history of warts, that kind of points more towards the psychotic miasm, not the soric or syphilitic. The tubercular miasm is related to TB. And at one time in the 17 and 1800s, tuberculosis was rampant and it kind of was passed genetically. And these are Drosera, uh, tuberculinum, calcareophos are three examples of remedies that hold the tubercular miasm. In the tubercular miasm, it's very characteristic for lung problems. So if you have a family history of asthma, pulmonary disease, if a weak part of your body is the lung, then that is characteristic of the tubercular. We also talked about the cancer miasm, and carcinosin is the prototype remedy of the cancer miasm because the carcinosin is actually a homeopathic remedy that is made from cancer tissue from the breast. Um, Staphylos aurea, Arsenicum album are also part of this miasm. The syphilitic miasm, mercury, and is all of the mercury remedies are the syphilitic miasm. Syphilinum is a homeopathic nosode made from a syphilis lesion, and aura metallicum. So you can see the continuum here of the miasms. We talked about the soric, psychotic, and syphilis, but these are other miasms that are in between. So it begins with acute, soric, psychotic, tubercular, cancer, and syphilis. So one of the goals in studying homeopathy and learning homeopathy is to understand these miasms, to categorize remedies into the miasms. And then when you are taking a homeopathic case, is trying to evaluate how the individual is reacting to the disease state. What is the body doing? Because each miasm will have a particular way of reacting. For example, the tubercular miasm has a tendency to react to stress and disease by getting pulmonary problems. The psychotic miasm has the reaction of a hyperproliferation, either warts, tumors, high blood pressure, high eye pressure. And the syphilitic reacts by destruction, deformities, ulceration. So it's a certain inherent nature. And the miasms, studying the miasms, are one of the best ways to understand the nature of disease and how to select a homeopathic remedy. In the repertory, and you can look, if you look under generalities, and I'm going to open up my repertory and I'll tell you the page. And I'm looking in Kent's repertory. You can look generalities, psychoses. Let me see if I can find a page. And that's on page 1406, generality psychoses. And you can see in Kent, he has the group of remedies. And of course, right under psychoses is syphilis, general syphilis. Now, there isn't a symptom, generalities tubercular. So you have to look under chest ptisis. That is the tubercular remedies. Anytime you see the word ptysis, that's an old term for a tubercular change. Uh, for the eye doctors that are in this seminar, you've heard the word ptysis bulbi, which is like a complete destruction of the eye. And this is something that we saw when tuberculosis affected the eye. You can get ptysis of just about any part of the body, and that's just an old expression for tuberculosis. For the cancer miasm, you can look under generalities, cancerous affections. So the presence of a strong miasm can help you find the right remedy. And some remedies just don't fit. The miasm affects the prognosis. We're studying acute, and the acute miasm, as you know, is something that begins quickly and responds extremely well to homeopathic treatment. The syphilitic is the worst miasm to have because usually this is very, very deep pathology. So I hope you had a chance to open up your repertory under generalities and look under psychosis and syphilis. In the chest section, you can find the ptysis and generalities cancer. So this is like a starting point for you to look over some of the remedies. Now, Hahnemann described only 3 miasms, and there's still a lot of homeopathic doctors who only believe in the 3 miasms. So they kind of categorized the cancer miasm and the tubercular miasm under the syphilitic miasm, and the acute and the psoric as one miasm. Rajan Sankaran has even expanded it to include the malaria and the leprosy miasm. So when you start reading the homeopathic literature, you're going to find out that there are these new miasms that are coming into the existence. And just this past week or past month, when I was at the Chicago meeting, my friend Carl Robinson feels that there may be an additional miasm called the Illumina miasm, which I thought was kind of fascinating. He did some research in that many of the children now that are being raised have received something like 50-fold the safe level of aluminum because of adjuvants in vaccines and immunization. And of course, alumina is also a problem with our antiperspirants. Our antiperspirants have alumina. And at one time, we had alumina cookware. And the reason why he has become very much interested in this miasm, his wife suffered from chronic sinus problem and asthma, and she had seen the top homeopathic doctors in the world, because Carl travels all over the world, and was treated, and nothing seemed to help her asthma. Nothing seemed to help her chronic sinus. And Carl began to treat her with a low potency of alumina, and then all of her symptoms improved. So he has studied this in detail, and the really shocking thing that I revealed from this is right now one of the keys of alumina is delusions. Thinks he is great. Delusion, he has a lot of fans. And if you look at the younger generation, with Facebook, everybody is a celebrity. You got a Facebook page, um, you have a birthday party, it's on Facebook page. You have a bowel movement, you post it on Facebook page. It's like, and you have all these imaginary friends. I got 5,000 friends, and some of them, never even spoke to. So there's this whole idea of living in this imaginary world, which is a strong, an Illumina. Illumina has a strong problem with identity. And we have a whole generation that's coming up. Little Johnny takes last place in a race, and he still gets a trophy. Congratulations, little Johnny. You're a winner. Everybody's a winner. So we have this whole generation that's growing up that's living in this delusional state, that they're all winners, they're all special. Um, they all have 5,000 friends. They're all being followed on Facebook. And Carl feels that this is part of the Illumina miasm that is adversely affecting us. And of course, this Illumina miasm, you can extrapolate it to Parkinson's disease and Alzheimer's disease too. The Illumina that's affecting the neurons that are causing these degenerative disorders. So one thing that is essential for homeopaths to understand is sometimes a homeopathic remedy will not work unless the underlying miasm is treated. So the ideal situation is that you prescribe a homeopathic remedy that takes care of that miasm. So if you have a case that has syphilitic symptoms and you do not prescribe a remedy that treats the syphilitic miasm, it's not going to work. So in some cases, you actually have to prescribe the remedy for the miasm. So you would prescribe syphilinum. You would prescribe serinum, the actual remedy for that miasm, before you would prescribe the particular homeopathic remedy. So in Carl Robinson's case with his wife, none of the homeopathic remedies worked well until he treated the underlying miasm, which he feels now is the aluminum miasm. So it's very, very interesting, and I think it's something that we all have to consider. Okay, so now I want to go through, I think we have a question here. Deborah, do you have a question?
Yes, I do. Can you hear me?
I hear you fine.
That's a extremely valid information you just gave us, which we're not going to find in any current book. But on something like that, would you give the remedy to them just once and then see how they feel, or would you continue that at a real low dose for how many hours or days?
Okay, that's a very good question. And homeopathy has proven, and after I finished this meeting in Chicago, I came away with a lot of more enthusiasm for treating heavy metal poisoning with homeopathy. That there have been many homeopathic published studies that have shown that homeopathic remedies can treat lead poisoning, mercury poisoning, and alumina poisoning. And the way it's usually done is to repeat the remedy every day. And the recommended dose is a 6C. So you really don't want to go too high. Take a 6C every day. So if you have lead poisoning, you would take a 6C of plumbum every day. If you have mercury poisoning, a 6C of mercury. Alumina, and what Carl Robinson's wife did was took a 6C of alumina every day. Now, I think it's important too that you do get a 6-hour urine analysis. You just don't begin taking these remedies thinking that, I have mercury poisoning or lead poisoning. So if your urine test does show an elevated heavy metal, and I think it is essential that you do a 6-hour challenge test, because if you just do a urine test or a blood test, it's not going to show, because if you do have heavy metal poisoning, it's going to be locked into your body and it's not going to be in your urine. So what I recommend is you first of all, you evaluate to see if you have heavy metals, and then you begin taking that low potency, the ideal dose is a 6C, simply because when you're dealing with these toxic metals, if you're taking an X potency, you can get some of the physical substance. So you do not want to take a mercury 10X or a lead 10X or something like that because it has physical substance in it. When you're taking a 6C is ideal because a 6C is a point where it's a low potency, so you're not going to have the risk of an aggravation or approving. And at the same time, it is going to be safe that you're not taking the actual physical material. Now, how does this work? Well, there was one theory, one homeopathic doctor at the meeting says that this low potency, 6C, actually changes the polarity of your cells, and it helps that particular metal to be excreted. And I got a list of articles, and if any of you are interested, there was a homeopathic doctor from Harvard University who has done research in using low potency homeopathic remedies to treat heavy metal poisoning. And she uncovered many, many research articles, both in humans and animals, that conclusively showed that low potency homeopathic remedies can help detoxify the body. So this is really, really great. And, I don't have any practical clinical experience with it, but this is something that I'm going to be considering, for all my patients that have heavy metal poisoning. I'm not going to, replace IV chelation and some of the other things that I do because I think that the IV chelation is probably more powerful and it does a lot of other health has a lot of other health benefits. But I may be singing a different song in a couple of years after I get some experience. So the 6 potency is. So do you have your hand's still up, Debbie? Did you have an additional question?
No, I'm fascinated by this because in 20 years of me seeing doctors' data, urine tests come back. I don't think I can ever remember a test coming back where there wasn't some sort of problem on one, two, or three heavy metals because I think it's just in everything we touch and eat and breathe and all the products we touch. I mean, have you ever seen one come back clear where there's no heavy metals to be concerned about?
Actually, mine was pretty normal. Maybe just a slight elevation of lead, but everything was in the safe zone.
Well, a safe zone can be debatable. You know, doctor's data shows one third this, one third that. I mean, I like to get it even lower than that because that test kind of says, well, the first little section, which is the safe zone, there's still some there that we can work on.
Right, but this is exciting because now homeopathy, this just is in theory. This actually works, and it could have a great application. Application. Okay, so the acute miasm is is a reaction to stress instinctively. So you have a perceived threat or attack from the outside. Um, there's no thought process. I think the best example of this is like if we're all in a room, if we're all in a classroom, and a bomb goes off. It's an instinctive reaction. You don't have to think. It's not like, oh, I see the bomb, there's light, I hear the noise, I better move. There's no thought process. And this miasm is the acute reaction that our body has. And Rajan Sankaran talks about the state of infancy. So these miasms have a way of showing our evolution from childhood to adulthood. So the acute miasm is peekaboo, where it's a quick reaction. I don't see you, I see you. There's really no thought process. It's acute. The nice thing about the acute miasm, it can quickly resolve, just like any acute reaction. It responds very well to homeopathy because it's on a fundamental low level. So these are probably the most gratifying cases to treat as a beginner. The acute miasm. The psoric miasm. The theme in the psoric miasm is the word struggle. So it's really not debilitating. It's something that is, like an itch, a skin problem. And, we know from studying homeopathy that kind of like all disease first enters us from the outside and then goes into the body. So the psoric miasm was the first miasm, but because we use lotions and steroids and antibiotics, we push that psoric miasm deeper and deeper into the body. It also has to be some contagious element too, because psora is caused by the mite. So this skin lesion is contagious. So if you touch somebody with the psoric miasm, they're going to be transferred to your skin. But there's also another element that every miasm has a physical and now actually a moral. So there's like a moral problem with the psoric miasm. It's if your skin isn't clean, you perceive that person as kind of being dirty mentally too. Somebody that's unkept. We don't look at them being unkept on the physical level. We looked at them having a disturbance too on the mental and emotional level. And Hahnemann felt that the psoric miasm was the foundation of all disease. All disease came from the psoric miasm. And Hahnemann kind of likened this to original sin that's taught in the Christian faith, that men are born with this original sin. We left the Garden of Eden where there was no disease and the original sin. The psoric miasm is this original sin. So the psoric miasm is the basic fundamental of all disease. All disease comes from the psoric miasm. And it began with a skin problem. And mankind wanted to cover up the skin problem. And as he covered up the skin problem, he pushed that disease deeper and deeper into his body. And then that manifested becoming a more and more serious problem. So some homeopaths believe that all of us have remnants of the psoric miasm and that we're never going to be cured because that psoric miasm just lingers on. Many times a homeopathic person will be treated successfully. Some of their serious physical problems will go away, but they'll be left with like a small patch of eczema or psoriasis that just will not leave. So if somebody has severe asthma that's treated successfully, or chronic arthritis is treated successfully, or an eye problem, they'll be left with the small patch. And no matter what you do, homeopathically, you can't get rid of it. It's kind of like an outlet of their body. It's the last residual part of their disease. And whatever you do, don't do anything. Don't treat it. Don't suppress it. Don't push it back into the body because then that will lead to a recurrence of the main disease. Okay, let's talk about the psychotic miasm. The psychotic miasm, as I mentioned, has to do with the idea of excess, extroversion, hyperfunctioning, too much. And the basis of the psychotic miasm is gonorrhea. And in the gonorrhea infection, you do get a lot of discharge. Later on, the gonorrhea discharge can be related to venereal warts, etc. So there is a lot of underlying sexual abuse in the psychotic miasm, sexual dysfunctioning, compulsive behavior, neurosis, guilt. Also, in the psychotic miasm, it's better discharge, worse suppression of discharge. Just like the psoriatic miasm, you have the skin lesion and the itch. And if you do scratch, you feel better. And if you put something on to suppress that skin lesion, you're going to be worse. So with the psychotic miasm, it has this idea of a discharge. If you suppress the discharge, you're going to get physically worse. So that's one of the characteristic features of the psychotic miasm, worse discharge. In fact, when I was a homeopathic student, we remember dealing with a case of someone that had a marked amount of sweating or discharge from the feet. And it was suppressed, and this is in the homeopathic literature, ailments from suppressed perspiration. So you really have to wonder, in this particular case, they put on foot powder, things like that that suppress the discharges of the feet. And then they developed severe physical pathology. I think it was arthritis or asthma from that. So you really have to wonder on what antiperspirants are doing in terms of suppressing discharge. And I already talked about the idea of the alumina in the antiperspirants, which is causing a problem, but just the act of suppressing the discharge. So the psychotic miasm has this sensitivity. The suppression of discharge will make it worse. The other interesting thing is that they try to hide their weakness. They cover up their weakness. They overcompensate. So, for example, some of the best public speakers have a fear of public speaking. They're covering up their fear by excelling, in that particular. For example, if I was a psychotic eye doctor, maybe I have this innate fear of blindness, and I'm overcompensating by becoming an eye doctor. So a key in the psychotic miasm is that they have a weakness and they try to cover up that weakness. And they develop habits to cover it up. So they have this inner feeling or incapacity of weakness. This is a lot different than the psoriatic because they really don't recognize a weakness. In fact, they are just annoyed, by this, minor irritation, and it really doesn't limit them to that extent. For example, sulfur is a homeopathic remedy that is very egotistical. Sulfur often has rashes and itches and discharges. And there's one particular rubric that the sulfur, which kind of explains the sulfur characteristics. Sulfur feels that their perspiration doesn't stink, that their odor is actually good. So it really doesn't, bother them or limit them. But the psychotic miasm, the disease becomes a little bit deeper. They are aware of their weakness. They want to cover it up. So the psychotic miasm would be very much ashamed of perspiration or discharge that had an odor, and they'd want to cover it up. They don't want you to know that they have this inner feeling weakness. They don't want to know that you're not capable. So that's the characteristic of the psychotic miasm. Questions on the psychotic miasm. And the main remedy for the psychotic miasm is metaritum, because metaritum is the nosode for gonorrhea. And the foundation of the psychotic miasm is this inheritance of gonorrhea. So the psoric, metaphorically speaking, is original sin. It's the basis of all disease, beginning on the skin, the itch, the scratch. That is just a nuisance that, in a way, we want to cover it up. But we suppress it, push it deeper, then it becomes a psychotic miasm. So the expression is a little bit more marked. Instead of having a skin problem and an itch, we get a discharge. We get this excess, this hyperfunctioning. So high blood pressure, high eye pressure, discharge, warts, overgrowth, tumors are all part of the psychotic miasm. Now, the tubercular miasm was not originally in Hahnemann's classification, and there's a lot of homeopathic doctors who only believe in the three miasms, the psoric, the psychotic, and the syphilitic. But the tubercular miasm falls somewhere between the psychotic and syphilitic miasm. This is the history of tuberculosis, respiratory problems. There's a tremendous effort and struggle. These people are burning the candle at both ends. They're very romantic. The grass is always greener on the other side. They love to travel. They're never satisfied. So the theme in the tubercular is this effort and struggle. And they burn the candle at both ends in order to compensate for this effort and struggle. They're very romantic. And this thing, the grass is always greener on the other side, is one of the reasons why they love to travel and are never satisfied. They always feel that they move to a new place, they're going to be happier. So there is kind of a discontent inside, which is a little bit more severe than the psychotic. And the main physical manifestation in the tubercular is focused on the lungs. Tuberculosis, respiratory problems, asthma, chronic disease. So when you have somebody who has this inherent weakness that their lungs are always involved, frequent colds and flus, think of tubercular, especially if they have some of these other unique characteristics, love to travel, and also hyperactivity in children. This is one of the number one remedies for hyperactivity in children. Think of the tubercular miasm. The cancer miasm also falls between the psychotic and the syphilitic miasm. The focus is on the need to be perfect and perfectionism. And it's kind of interesting because cancer is a disorganization. It's, the body is gone amok. So on one hand, physically, these people want to be perfect, ideal, and because of this idea of failure, that they're not able to maintain this perfection and perfectionism, that's when cancer develops. These people have codependency. They're very fastidious, restlessness. And the theme with the cancer miasm is chaos versus control. Cancer is chaos. These people want to maintain control. So these are the most controlling individuals that you'll find. and this remedy, they need to have a certain amount of perfection. Carcinosin is the main prototype of the cancer miasm, also Staphylos aurea and Arsenicum album, aurum. So there are many, many different cancer miasms. And um, of course, there's typically a strong family history of cancer. Um, um, so this is a very, very prominent miasm in our society. And when you are doing your homeopathic case taking, it's important to recognize it, especially you can pick it up very easily when you're talking about their childhood. These are very serious students in school. They like to do a lot of reading, a lot of control at an early age. Overachievers. They're also very sympathetic and sweet, very neat, codependent, and this whole idea of chaos versus control. Cancer is chaos of the body, and it's a battle between control. And, typically when these individuals do get cancer, they will take every heroic measure to control the cancer. It's like a battle. They'll work on chemotherapy, diet, everything to, battle this part of their body out of control. So in a way, it's probably the most um, serious disease that a cancer miasm can get is cancer, because their whole being is about control, and now there's part of their body that's out of control. The syphilitic miasm is the end stage. We got some questions here. The question is, can we get info on metal that you learned in Chicago? And I'll send that to everybody, okay? Oh, what was the name of the remedy you mentioned was the main one for syphilis? It's called syphilinum. Syphilinum is the main remedy for syphilis. And the three main remedies for cancer, well, there's many, many remedies for cancer, but the number one remedy is carcinosin, and that's in your slides. If you back up a few slides, when I do mention the cancer miasm, I list those three remedies: carcinosin, Staphylos aurea, and Arsenicum album. But remember, they're not the only three remedies. So just because somebody has cancer doesn't mean one of those remedies is going to treat the cancer. There's probably 1,000 remedies that can treat cancer. And if you are interested in cancer, there's a book out called The Homeopathic Treatment of Cancer by Dr. A.U. Ramakrishna, 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 A.U. Ramakrishna. It's available online. And I had the pleasure of actually studying with Dr. Ramakrishna in Mumbai, India. I was a guest at his home for a month, and he has successfully treated over 5,000 cancer cases. He's a brilliant homeopathic doctor who knows homeopathy and knows the treatment of cancer. And so if you're interested in that, I would highly recommend his book. Any other questions? Okay, let's talk about the syphilitic miasm. And this is the most destructive miasm. Energy is turned inward, not only destruction of the physical body, but destruction of the mind. So these are the most depressed individuals, the ones that have the most despair, hopelessness, advanced alcoholism, mental disease, congenital deformities. This is the syphilitic miasm. They also tend to be worse at night. We studied the mercury remedies. All of them are worse at night. And the mercury remedies are highly syphilitic. Um, they have a tremendous amount of pain, especially in the bones. And once again, the pain tends to be worse at night. They also tend to be very obsessive compulsive with focus on dirt, cleanliness. And these are the obsessive hand washers, the people that are, will hold a paper towel to open up a door. They're, worried about germs, and this is obsessive compulsive. Ulcerous skin problems, um, all about change and radical change and destruction. And so, in terms of eye disease, when you get corneal ulceration, hereditary dystrophies, congenital problems, these are things that you want to look at the syphilitic miasm. So remember, the beautiful things about miasms is that whenever you are doing a homeopathic case, especially constitutional, you want to kind of try to find out what miasm that person is. And then you can begin to look for homeopathic remedies that kind of fit that miasm, because a remedy will not respond unless it covers that underlying miasm. It's kind of a fundamental law in homeopathy. Now, a nosode is made from a disease product. So, for example, Soric, which we cover it, Sorinum, is made from the scabies, which was considered the original sin of mankind. The psychotic, Metaurinum, which is from gonorrhea. Tubercular, Tuberculinum. Cancer, Carcinosum, which is breast cancer. Syphilinum, syphilis. And the acute here is Lysinum, which is the rabies virus, which gives the acute presentation. So this is the definition of a nosode. And we do have all these nosodes in homeopathy. And then sometimes it's necessary to use the nosode treatment to treat the underlying problem. So if a well-selected remedy is not working, you have to treat the miasm. And sometimes the miasmatic remedy needs to be used to treat that. Okay, we've covered the miasms, which can be overwhelming at first. Um, but I would highly suggest that you read about the miasms. There are some good homeopathic books which cover the miasms, and Hahnemann in his Organon talks about the miasms. So before we break for lunch, I wonder if there's any questions on what we've covered so far. Any questions? Okay, so if there are no questions, then we'll break an hour for lunch. It's close to noon, so we'll come back at 1 o'clock. So any questions before we leave? I'm checking here. Okay, the question is Rama Krishna. Yeah, Ramakrishna, Rama Krishna. And his first name is A period U period. Dr. A period U period Ramakrishna. And the book is called Homeopathy in the Treatment of Cancer. And you can probably Google that name, Homeopathy in the Treatment of Cancer, or, spell his last name. Okay, well, I'm going to take a break, get some lunch, and hope all of you have a nice break. And we come back, we'll talk about um, breast conditions. And so I'm going to sign out now. So you may have to rejoin me when we come back. Okay, see everybody after lunch.